This is Robert Kraft, and I'm coming to you live on SNNLive, and we're at the 9th annual LD Micro main event in Bel Air, California. With me right now is JJ Finkelstein from RegeneRx, publicly traded company with the symbol RGRX. JJ, welcome back to SNNLive.
Good to be here. It's been a while.
It's been a while, that's for sure. So before we get into that update, for our audience, let's get an overview of the company and go from there.
Right. Well, we are a small biotechnology company that is developing a number of products. Our furthest along products are RGN-259 for the treatment of dry eye syndrome and neurotrophic keratopathy. We're in phase 3 trials there.
So it's been a bit since our last interview. So let's get an update as to what's been going on in the company. Can you?
Most recently, we started our second phase 3 trial with RGN-259, as I said, for dry eye syndrome. We expect to finish that trial around the third quarter of 2017, maybe into the fourth quarter. And we also initiated earlier, actually in 2015, a phase 3 clinical trial for neurotrophic keratopathy, which we also hope will be completed next year.
So I also saw recently in the news that you had a number of deals that you've been putting together in the company. Can you comment on that a little bit?
Sure. Yeah, we're very proud of a number of deals that we've put together. Licensing deals in Asia. We have a licensing deal in China with Lee's Pharmaceuticals, and a licensing deal in Korea and other parts of Asia with RegeneRx BNT, a Korean company. Which include upfront payments, royalties, and milestone payments. And we also put together a joint venture in the United States that, with our Korean partner, that we have about a 40% interest in, as well as royalties, that is developing our products, our ophthalmic products here in the United States.
So on the licensing that we just discussed, do you want to expand on that a little bit further?
Yes, we think it's a really creative joint venture. Our partner, RegeneTree, is responsible for funding 100% of the developmental costs. So we have no financial obligation, but we still own a very significant percentage of the equity as well as a royalty. The other important feature of it is that we serve on the board of the joint venture, and it takes unanimous board approval for any future transactions, any material transactions. So we have the ability to control whether or not we want to complete a transaction. Works well for both parties.
Tell me a little bit more about the programs that you have going on, both currently and you expect some results on.
Well, our phase 3 program is focused primarily or exclusively on ophthalmology, ophthalmic disorders, as I said, dry eye syndrome and neurotrophic keratopathy. We feel like we're very close to getting a commercial product out there. If we're successful next year, then we'll be very excited about that opportunity. And of course, being a small company, we and our partners, through our joint venture, are talking to a number of multinational pharmaceutical companies about the ultimate type of development or commercialization that we want to go forward with them in the future once we complete our clinical trials.
So where can our audience go and find more information about the company?
www.regenerx.com has all of our most current information as well as a recent presentation.
My name is Robert Kraft, and I'm coming to you live on SNNLive, and we're here at the 9th annual LD Micro main event in Bel Air, California. With me again is JJ Finkelstein from RegeneRx, publicly traded company with the symbol RGRX. JJ, always a pleasure. Thank you.
Thank you very much, Bob. Good to see you.